The CDC is tracking several clusters of people sickened by monkeypox. The viral illness is usually only reported in Western and Central Africa, but now there are 2 confirmed cases here in the U.S., in Massachusetts and New York, and dozens more in Europe. So what exactly is monkeypox, and how concerned should we be about the cases? The Fox Medical team's Beth Galvin joins us live now to talk more about it. Good morning, Beth. Thanks for joining us.
And good morning to you, Leslie. Thank you for having me.
Yeah, absolutely. So let's talk about what monkeypox is and what are some of the symptoms that come with it.
So monkeypox is an illness that is caused by the monkeypox virus, and the monkeypox virus is in this family of viruses called orthopox viruses. Another very similar one is smallpox that you've probably heard about plenty in your lifetime. It's been eradicated. And as you mentioned, it's usually seen in certain areas in Central and West Africa. Now they're seeing it in areas where they don't typically see it, and that's what the concern is about. They're seeing it in Europe. They're seeing it in North America. The World Health Organization saying it has at least 200 cases of either confirmed or suspected monkeypox in North America and Europe right now that they're looking into. And the agency also saying that the sort of a common thread in these tends to be gay and bisexual men who are having sex with other men. Seems to be at least one possible route for how this virus is spreading through close contact. The virus typically starts out very flu-like, so you may feel fever, body aches, headaches, swollen lymph nodes, and then you will develop typically that telltale rash. It'll evolve into sort of these lesions on the skin. And the CDC had a press call last night with reporters to talk about this, and they said that, in some of the cases here in the U.S., they're looking at 5 either now confirmed or suspected. They suspect really all of them are smallpox. All of them are men who traveled outside of the country, and they say that in some of the cases, the rash looks kind of like a sexually transmitted disease. So it looks like, you may have something else going on, so you might go to the doctor thinking you've got one thing going on, and they want doctors to be aware that this rash can look like an STD. So really to be thinking about monkeypox if they're, someone has a travel history, if they've been around somebody with a travel history. So it doesn't necessarily anymore need to be a travel history to Africa or, to West or Central Africa. It could be, just a travel history out of the United States. Leslie?
Yeah, Beth, and, taking a look at some of these clusters, we heard the president say this is something that all Americans should be concerned about, but then he came back and said, well, not like a COVID-19 level. So how concerned should we be about these clusters, and what are we really looking at here?
Well, it's funny that you mentioned that not a COVID-19 level, because one of the investigators who was talking on the call yesterday said clearly this is not COVID-19, that we've been dealing with monkeypox, small outbreaks for 50 years. We had one in 2003 here in this country that was tied to imported small animals like prairie dogs and things like that. So we do have 2 different smallpox virus vaccines that could possibly be used if we needed to protect people around those cases. We also have an antiviral that works for smallpox and might possibly work for monkeypox. So we've already got, some tools to help fight this virus if it did spread here in this country. And there's an awful lot of knowledge about this virus. And what they're saying is this is not the kind of thing that somebody is going to cough in the grocery store and you're going to likely, pick up monkeypox. This is the kind of thing that requires close contact. For example, touching the lesions that somebody has, washing their bedding, or being in very close prolonged contact with somebody who has active monkeypox for you to be able to get the virus. The investigator said at one point that they had a case with an outbreak in Nigeria where 9 travelers traveled internationally, were on planes for hours, and not one of those travelers who had an active case of monkeypox passed it on to somebody else on board those planes. So I think we're looking at this is concerning because it's happening in areas where we don't typically see it. We don't know very clearly why it is spreading or how it is spreading from one person to another. But they're saying, that the risk to the American public is really, really low, and right now we've only got five cases either suspected or confirmed as of last night.
Yeah, absolutely. So something to be aware of, no panic. We
Yes.
appreciate your time
Yes.
this morning. Beth Galvin with the Fox Medical team. Thanks for joining us. We'll be right back on Good Day.
Thank you.